Okay. Hi, so let's go ahead and get started. I think anybody who's participated in a webinar knows how to use the Q&A section of the webinar. I've already collected a lot of questions. I encourage anybody who's listening to this live to go ahead and submit your questions. Anybody who's listening to this as a recording, go ahead and submit your questions to info@oceanadvisors.com, and I'll be happy to circle back to you, connect you to somebody from Move Health who could probably answer the questions a little bit more deeply. What I noticed when I was reviewing the questions that already came in was that the questions were so unique to your individual circumstances that we could be here all day in a Q&A section and probably wouldn't do the justice that it deserves for your answers because unfortunately, I think I would be putting our guest today in a position where he had to predicate every answer by the disclaimer, well, it all depends. And I
Yeah.
don't want to do that. So we'll collect the questions. If I can answer them, I will. Otherwise, I'll refer them over to Move Health. Um, so those of you who are listening to the recording who may not be familiar with me, my name is Drew Waterbury. I am a, CFP practitioner. I've been in the industry a long time, let's say well before internet was even a thing, and we'll just leave it at that. Um, as a CFP, obviously we are trained in a lot of areas, but there are areas that over the years I've come to realize that we just don't know enough about. And if I'm really being a fiduciary and fulfilling my part, then what I want to do is make sure that I'm connecting my clients to the subject matter experts so they can get the services that they need, the answers that they need, in some cases, the products that they need. And when it comes to Medicare and the many, many moving parts with Medicare, uh, I am happy to collaborate with Move Health. It's a really great arrangement where, clients for whom I know a lot of your financial information already, I can work directly with you and Move Health so that we create a financial plan that coordinates with your Medicare needs and requirements. So, with that in mind, I want to introduce the person that or and the company that I've decided to collaborate with, which was a really simple decision to make, and that is Cole Craven with Move Health. Cole, can you just tell the listeners a little bit about yourself, and then we'll start getting into the nitty-gritty of the.
Yeah, of course. I know everybody's really, really excited to dive into Medicare on a stormy Monday, Drew, as we're recording this. But no, really, for a lot of folks, it is a big concern, and it's a when do I need to do, and what do I need to do, and how do I do it, and what and why and what and all of these things. And so, that's the questions we'll get answered today. But yeah, I'm one of the co-founders and the head of growth at Move Health, which means that I spend a lot of time with folks like you, Drew, financial advisors, telling them about why healthcare planning is important, right? It's a top three, typically a top three concern in retirement. And, I felt so passionately about this because I watched, my background is in health insurance and Medicare, but I watched my in-laws go through this exact scenario, right? Where they were saying, hey, we're getting ready to retire. What do we need to do with this part and this part and this plan and these things? And what about my income and how does that have an impact on this? And so we started Move Health after experiencing that, and so it's been off to the races. So a little bit about Move Health. We work with financial advisors and their clients across the country, and it doesn't matter if you are Medicare eligible, like we're going to talk about today, or if you're pre-65 and you're considering retirement before the age of 65 and you're trying to figure that out as well. We can help with that, and we work with people like you, Drew, who are sitting down with clients and saying, "Hey, we need an answer to this." And Drew, kudos to you. And we've known each other for quite some time now. Of you know enough to know that you don't know, right? And
Yeah,
on
unfortunately.
everything. And so that's a good thing, right? To know when to tap out and when to tap someone in. And so that's what we're here for. So maybe more importantly than my role at Move Health, I'm a husband and I'm a dad. My wife is incredible. We've got two little boys and another one on the way. And Drew, our newest development is that we added five more things to our household. We got chickens this past week, and so we may have made a grave mistake, but we'll see. Our little homestead continues to grow. So glad to be here.
Great. And one thing I've always appreciated about you is that you're always mentioning your family too. And that strikes a chord with me. And I
I would
think
be remiss if I didn't. Yeah.
I think you're being a little bit humble with Move Health, which was recently recognized in that T3 survey as the number one go-to collaborator for Medicare
Yeah.
with financial
Yeah.
advisors. So congratulations on that. But
Well, thank you. It's been a lot of fun. And so yeah, our team, that's a, total tribute to our team and the work that they have done and that we've all put in as we've continued to grow. And so yeah, thanks for bringing that up, Drew. It's great.
okay, great. So let's get in the meat and potatoes of this. I think I heard a number recently. Was it 12 or 15,000? Well, let's go with 12 so I'm safe. People are turning 65 every day in this
Mm-hmm.
country. That's a
Yep.
lot of people. So a lot of individuals out there are looking at this and wondering, how do I even get started? And when do I get started? So let's address the timetable on when you get started with
Yeah.
filing for Medicare.
Absolutely. So as we think about and we're gonna kind of treat the conversation, Drew, if it's okay, because there are so many it depends questions, right? And things
Right.
along those lines. And my job, if you look over my shoulder, is to make things simple and clear. So today we're gonna kind of level set and say this is someone who is turning 65 and making the transition to Medicare. There are times where you don't need to make the Medicare transition at 65 if you continue working. There are some people, less people, that would make the transition to Medicare before 65. But all that to be said, we'll talk about turning 65 and some things to consider. And so, if you are turning 65 and making the transition right then, Move Health, we like to start that conversation 6 months before your 65th birthday. So 64 and a half. This is also right in line or just before you start getting all of the mailers and
Yeah.
phone calls and emails and all these things from people that are trying to sell you something, right? And so
Hmm.
important to start that conversation early with a someone you trust or through someone you trust, right? And so we serve thousands of people every year with this transition to Medicare, and so very well versed in it. We like to start the conversation 6 months beforehand. Why? Because there's a finite amount of time when around your 65th birthday when you can make a transition to Medicare to avoid penalties and to kind of do it in the right timeline, right? And so it's actually a 7 month window, right? And people go, 7 months, what on earth? It's you can apply for Medicare Parts A and B, and we'll talk a little bit all those parts and plans and things in a bit. But you can sign up for traditional Medicare 3 months before your birth month, the month of your birthday, and 3 months after. So you've got a 7 month window, and this is called your initial enrollment period or your IEP. And so your initial enrollment period is when you can pick up Medicare A and B, and you can pick those up without accruing penalties, right? There are times where someone could enroll into Medicare later than that window, and they may have these things called late enrollment penalties that could happen. And so we like to start the conversation 6 months before your 65th birthday. So 64 and a half, start the conversation. About 3 months before 65, you then apply for Medicare Parts A and B. And then by the time that you get to the birth month, right? So, and the reason I say birth month is because you've got, if you were born on, March the 15th, your Medicare would begin on March the 1st. A lot of people don't know that, right? Your Medicare starts on the first of the month in which you turn 65. And so all of that to be said, 3 months before we like to start the A and B application. That way, when you get to that month where Medicare begins, you've already got your supplement in place, your drug plan in place, your Medicare ID cards in hand, right? So there's no scrambling and things along those lines. And so start the conversation 6 months beforehand. 3 months beforehand, we like to start the application process for A and B, and then that gives us that full window of time. But you've got 7 months, so 3 months before the month of your birthday, and 3 months after is that initial enrollment period.
Okay. And you're mentioning A, B, and I know that it's an alphabet soup. Medicare
Yep.
is an alphabet soup. Can you kind of introduce us to some of the characteristics of the different letters?
Yes, of course. So I will say with Medicare, original Medicare itself, there are parts, right? So you'll hear parts and plans, and we'll talk about plans later, but right now we're going to talk about parts, A and B. right? And so we'll talk about Medicare Parts A and B right now. So Part A is the hospitalization portion of your Medicare. So this is going to be the part that one of our team members, I've stole it from them, is to say it is the hospital bed that you're laying in, it's the Jello that you're eating, and it's the nurse that brought it to you, right? So that's Medicare Part A. It's the hospitalization portion. And so with Part A, you have the you typically don't pay a premium for it. This is the one that you've paid for your entire career. That's Medicare Part A, the hospitalization portion. Part B is your medical portion, right? So Part B as in boy is the medical portion. This is going to be the doctor that you see, the surgeon that worked on you, the outpatient labs, the vaccines that you get, anything that you do in a doctor's office is going to be, subject to Medicare Part B. Part B does have a premium. It's a monthly premium. It
Mm.
starts up when you first start Medicare. So when you start your Medicare Part B, that is going to be, you're going to pay a standard premium in most cases. The standard Part B premium in 2026, when we're recording this, is $202.90. So you pay that every single month. There are some increases to that, which we can maybe touch on in a little bit. But Part A, hospital, Part B, medical, and this is what is considered original Medicare, right? So when you hear
Right.
the phrase traditional Medicare, original Medicare, you're typically hearing parts A and B. So you can think of that. So there's parts A and B. A, you don't pay anything for in most cases. If you worked 40 quarters or you had a spouse that worked 40 quarters, B, you pay a standard monthly premium of $202.90. There are some times where it can be more expensive if you had higher income. Uh, and then we'll kind of touch on, so that's traditional Medicare, parts A and B. I'm going to skip over C for just a second.
Yeah.
That's
Yeah.
important. And then I'm going to go to Part D. Part D is the only one phonetically that makes sense, which is D for
Yeah.
drugs, right?
Yeah. Right.
And so required to have prescription drug coverage. So a lot of times people will have original Medicare and a prescription drug plan in addition to a Medicare supplement, which we'll touch on in a bit. But Part D is prescription drug coverage. So it doesn't matter if you don't take any medications or if you take lots of medications, you have to have prescription drug coverage. And so with that, Part D, is a standalone insurance policy through a private carrier that you purchase through Medicare.gov or through a broker or things along those lines. Typically pretty inexpensive, but it's required to have you're required to have Medicare Part D coverage. And so A, B, and D are requirements, right? And then C is a different piece to that. But before I get there, any questions on kind of what we consider original or traditional Medicare?
Well, I did have a quick question about D.
Mm-hmm.
So if you're not on a lot of medication, how is
Mm-hmm.
that underwritten? Is it group or
Good.
individual?
Good question. So there's no underwriting for a prescription drug plan. So they're not going to ask for your health conditions or your height or weight or anything like that. You don't need to necessarily pass it. But the way that we would look at placing a Part D plan would be to say, okay, if you're not taking a lot of medications or you take no medications, it's a pretty black and white conversation where you say, okay, is your pharmacy that you would like to use in the event that you are prescribed a medication in network? Great. Is it the lowest cost plan? Yes. Check, check. Okay. There are plans that are $0 that cost nothing per month, but you need to have that coverage in place.
Okay.
If you're someone who takes the joke I always make, Drew, is if you're someone who takes a medication that sounds like it could be a European sports car, hey, we should probably look a little more closely at your drug plan to make certain that it's covered, right? One of the ones that we see often is a medication called Eliquis. It's a blood thinner, right? It's incredibly effective. But you could also hear like, "Hey, are you driving the newest Ferrari Eliquis?" And you're like, "Yeah, I am." So if it
Yeah.
sounds like that, it's probably good to pay good attention to your Medicare drug coverage.
Okay. Okay. Great. Thanks.
Of course. And then as I go into kind of part C, you heard me talk about A, which is typically premium free. B has that standard premium of $202.90. A standalone Part D prescription drug plan. Those are requirements. You need to have Part A, B, and D, so drug coverage. And then C kind of mushes all of that together, right? And we'll get to that. C, I don't is not a part of original Medicare, but Part C is Medicare Advantage, right? And so with that, that's going to take your A and your B and your Part D in most cases, and it's going to smush it all together, and they might add some extra benefits, and you might hear people talking about it on daytime television and all these things where they're saying, hey, Medicare covers, original Medicare covers 80%. You need to fill that gap. Here's a Medicare Advantage plan. What is not clearly explained in those typically is that it is a private insurance carrier that is now taking over your Medicare benefits, right? So administrating them on your behalf. When you're on original Medicare, right, you've got original Medicare A and B and D, and you typically have a Medicare supplement with that. Part C is taking all of those things and kind of mushing them together, and it's making a private insurance carrier the primary payer and primary administrator of your Medicare benefits. So when you're on a Medicare Advantage plan, that's where you will see things like networks and deductibles and copays and all those things come back into the equation. And so an Advantage plan is something you certainly could consider. Typically, they have low or no monthly premium, but we don't consider Part C a part of original Medicare, and you don't have to have a Medicare Advantage plan. I think that that's important for everybody here to understand, especially if you're working with a financial planner. You can work it into the financial plan to understand, hey, I can afford a premium for a Medicare supplement, which we'll kind of talk about here in just a second. But Part C, not an original part of Medicare. So typically you need to have Part A and B and D. And then Part C will take all of those and mush them together. You still pay your Part B premium. Many times an Advantage plan will not have a premium, and so it can look attractive from a cash flow perspective.
Hmm.
But it's typically going to be the thing where you hear people saying, well, I had to do prior authorization for this, and I had to do 20 sessions of physical therapy before I could have that hip surgery or things like that, because now it's a private insurance carrier, like the large ones are, WellCare and Humana and United Healthcare, et cetera. And now they're administrating this on your behalf, and they're saying, hey, before we pay for that hip replacement, we are going to, make you do cortisone injections, a round of those, and physical therapy to make certain you really need it, right? Because they're trying to protect bottom line to a degree.
Right.
And so Part C, not an original part of Medicare. And so that's an important piece of the equation to know as well.
Okay. Okay. Um, Looking at my outline here. So we cover that, cover that. Okay. Uh, Speaking of the different types of plans,
Hmm.
in one of the sessions that I had with you, you had a sheet
Hmm.
that you could you pull up that sheet that
Yeah.
shows the different types of plans?
Of course, of course. So I'm gonna do two things here. I'm gonna show one screen grab here, which I think is important to kind of tee up the conversation here. Give me just a second.
Sure.
And so I'll share that, and
While
then
you're
we will.
doing that, let me make reference to one of the things that you were referring to earlier, and that's who ends up paying a little bit more for their
Hmm.
coverage, and what the Social Security Administration does is when they're trying to figure out, well, what's fair premium wise to charge people, they
Hmm.
do a 2 year look back. And so they'll look at your income, let's say you're filing at age 65. They'll look at your income at age 63 to determine what you should be paying in. And there's a acronym IRMA that
Hmm.
applies, and it's income adjusted monthly uh,
The
adjustment.
income related monthly
Monthly,
adjustment amount, right? I live in it, Drew.
right.
That's why you have me.
Yeah.
So
I just call
um,
it IRMA, IRMA.
that's exactly right.
And from a planning standpoint, I know a lot of people are looking at doing Roth conversions and things of that nature, which
Hmm.
will kick in, increase your income during those years, depending on when you're doing them, of course.
Yep. Yep.
There's a way to appeal, like, hey,
Hmm.
this was a one-time event. It wasn't really a huge increase in income. It was really as a result of a Roth conversion or a unique situation. Okay, I had a one-time addition to my income,
Yep.
and we can help clients appeal that to Social Security Administration. I just wanted to share that while you were pulling things up.
Yeah, yeah, of course. I think an important piece of the puzzle. I always say Irma is not your auntie, and it's not a hurricane, right? It's the income related monthly adjustment amount, and You get to pay more for Medicare Part B and Part D if you did well for yourself. And so it's another way of just saying, hey, Uncle Sam will get theirs. And so I've got this pulled up here, and you should be able to see this here now, where there's kind of a fork in the road, right? So the things that are similar between each of these is that Part A and Part B and Part D are all a piece of the equation. So there's this fork in the road because traditional Medicare is only going to cover Part A and B, is only going to cover 80% of your overall costs, right? So some of this will be repeat, right? We talked about Part A being hospital, Part B being the medical portion.
Hmm.
But what we didn't touch on is that parts A and B are only going to cover 80% of those costs, right? So then as we go back to that fork in the road, we look at this and we say, okay, here's traditional Medicare and Medicare Advantage, right? Which direction do we need to go? And so Medicare Advantage we talked about combines Part A, B, and most cases D, and then traditional Medicare is going to keep all of those standalone, if you will. So if we remember Medicare Advantage, you're kind of signing away your Medicare rights or your Medicare benefits to a private carrier that's going to say, not so fast. You need to stay within this network, and you need to see this doctor before you can have that surgery, and we're going to do therapeutic, different therapies before we do surgeries and things like that to keep our costs lower. Now, whereas traditional Medicare, you are administrating your own Medicare. And that sounds like more work. It's not, I promise. It just means that your Medicare belongs to you, right? So Part A and B, you sign up for, you've got a Part D prescription drug plan, and then you usually have what's called a Medicare supplement or a Medigap plan. And that does exactly what you'd think it would be, which is it fills that 20% gap. So a Medicare supplement and a Medicare Advantage plan at the most basic level are doing the same thing, right? They're filling that 20% gap that original Medicare does not cover. The big differences are when traditional Medicare is alongside a Medicare supplement, Part A and B are primary, right? It means they're the primary payer. On Part C, Part A and B are the secondary payer. And so the insurance company over here is saying, hey, we want to limit our exposure. Whereas on traditional Medicare, Part A and B pay first, and then your Medicare supplement kind of bats cleanup, where it's going to come in and they're not going to ask, hey, did you check if this was in network or things along those lines? Because traditional Medicare, A and B with a Medicare supplement, operates on an open network, right? So all you have to ask the doctor or the facility or the specialist is, do you take Medicare and is this a Medicare eligible expense? If
Hmm.
the answer is yes, it is covered. You can go there, right? So, Drew, I know you're in North Carolina, right? So if it's a question of uh, hey, I want to go to Duke, yeah, right? Duke University's med school, right? A Medicare Advantage plan may say, nope, sorry, not in network. Whereas all you have to do is call over to Duke, and they do, right? And just say, do you accept original Medicare? And they'll say, yes. Great. Okay, you can go. You don't need a referral to see a specialist or anything along those lines. A Medicare supplement does have a monthly premium, right? So that's important to note as well. So you may pay more monthly for traditional Medicare, a Part D plan, and a Medicare supplement, but you're going to reduce your out of pocket exposure and your administrative burden significantly versus a Medicare Advantage plan. And so important to note that those conversations are something to consider. So we talked about Medicare A and B only covering 80% of the cost. We touched on IRMA, there for just a moment, but I'm going to sneak over to, how do you choose a coverage option between the two of these, right? So a supplement, you're going to have monthly premiums. You're not going to have that network to contend with, no referrals. You're covered anywhere Medicare is accepted, and you must have that separate prescription drug policy. Medicare Advantage, on the other hand, like I said, typically no monthly premium or low monthly premium, but you may be restricted to a specific network, and you may need to have referrals to a specialist. You might have an HMO network, and they may include drug coverage as well as dental and vision benefits as well. And so that's kind of how you navigate the difference between the two. And Medicare supplements, and actually I'm going to go back one here. Medicare supplements, Medigap. These were started when Medicare in the 60s was began, but it really wasn't standardized until 92, right? 1992. The most popular and comprehensive Medicare supplement you can buy right now is a Plan G Medicare supplement. So, Drew, I'm sure you have clients that are on Plan G Medicare supplements right now, right?
Yes.
Oh yeah. And so, Medicare A and B, like I mentioned, primary. The client that you, or the insurance company that you choose as the client, it's secondary, right? And so, you're never going to get a question from your Medicare supplement of we're not covering that based upon your insurance carrier that you choose, because if Medicare picked it up, your supplement is guaranteed to pick it up. And if your doctor accepts Medicare, they're going to accept your Medicare supplement. And so, a Plan G supplement, as in girl, plan, right? I said parts, that's Medicare. Plans are supplements. And so a Plan G supplement is the most comprehensive that you can buy if you were, not Medicare eligible or 65 before January 1st, 2020. Plan F covered everything, right? There was no out of pocket costs aside from your monthly premium when you had a Plan F, but you can't get that anymore. So the Plan G is as close as possible. The only thing that a Plan G doesn't cover is the Part B deductible, which in 2026 is $283. And so you can think of a traditional Medicare with a Medicare supplement and a drug plan as a health insurance plan that has no network. You can go see any doctor as long as they accept Medicare, and it's got a $283 maximum out of pocket. So it's a really, really good, flexible option. You might pay a little bit per month, depending on where you're at in the country. Typically, a Medicare supplement for someone turning 65 is almost always less than $200. There are some states where they're more expensive, but in a state like Indiana, where Move Health is located, a 65-year-old female, a Medicare supplement plan G might be $90 to $100 a month, depending on the carrier that you choose. So, Drew, the one that the slide that you kind of referenced is this
Right.
one here, right? So there are a lot of Medicare supplement options or plan options from Plan A all the way through to Plan N. Now, as I mentioned, the most popular is a Medicare supplement Plan G. Why? Well, if we look down this list, there's lots of green checks here, etc. The only thing that it's not covering is that Medicare Part B deductible, which is $283 this year in 2026. Last year it was $257, which is why you see that number there. There are lots of Medicare supplements, available, if you will. But the important thing to note is that a Plan G is a Plan G is a Plan G. So, Drew, it doesn't matter if you get a Plan G Medicare supplement with Looney Tunes Insurance Company, or if you get one with United Healthcare, you get one with Humana. They're all guaranteed to do the exact same thing.
But they're
In
not,
the
I'm sorry, I was just going to say, but they're not all priced the same.
Bingo. They're not all priced the same. And so that's important, right? So the CMS Center for Medicare and Medicaid Services phrasing for what they call this is being substantially equivalent based on the plan letter, right? So I said a plan G is a plan G is a plan G. So Looney Tunes Insurance Company might be $100 a month, and a name brand through a Blue Cross or something like that might be $200 a month. What's the difference in terms of coverage? Nothing, right? There's no difference in terms of coverage of what they're legally bound to cover. It's a Plan G.
Hmm.
Now, what they are different on is historic rate increases. So we're looking at how fast does the plan costs go up. So that's based on historical data. How long has the carrier been around? And so there are times where we will work with someone and we will say, hey, we're going to go help you to select a Medicare supplement. We almost never buy the cheapest one, right? And we also almost never buy the most expensive name brand one. And the reason being, when you look at, brand names that are highly recognizable, et cetera, a lot of times you're paying for exactly that, the brand name.
Hmm.
Now, on the other side, you might hear of, Looney Tunes Insurance Company that is brand new to the market and they look really attractive from a cost perspective, but it's because they have low enrollment. They're trying to boost enrollment, which means they're still figuring things out. And if they're small, then they might have less predictable rate increases. And so there's value to finding kind of the Goldilocks version of a Medicare supplement, which is stable historic rate increases, ease of use for claims, and things along those lines. And so typically, when we are helping someone into a Medicare supplement and helping them with the transition to Medicare, they're making a transition to a Medicare supplement plan G, and among that, there are a lot of different carriers that you could select from that will meet your needs because they're substantially equivalent. So it's based upon your location, things along those lines, how they're rated. And so hopefully that's a helpful overview
Yeah.
of Medicare supplements and the conversation between that and Advantage plans.
No, that's great. That's great. Now, when it comes to the Advantage plan, if you're in an Advantage plan
Hmm.
and you decide, hey, it's good, but I like the flexibility that my friends have, not having to, go through all these
Yep.
tests ahead of time before getting
Hmm.
getting medical care. How frequent do you see people shifting
Yeah.
between those plans? And it's not like something you go back and forth with, right? I mean, you really kind of need to find a home you're happy with.
Yeah. That's exactly right. So, what we typically say is it's really important to make the correct Medicare decision right from the jump. And maybe that's an obvious statement, but there's some reasons behind that, right? In most cases across the country, you have a finite period of time where you can get that Medicare supplement plan G or any other Medicare supplement for that matter with no medical underwriting, right? So we talked about medical underwriting earlier,
Hmm.
but with a Medicare supplement, there's a finite period of time from when your Part B starts, your Medicare Part B begins, that you can get a Medicare supplement with no underwriting. And so, why is that important? Because most of us that have made it to 65 or older, have gotten there with maybe some pre-existing conditions or height and weight that's maybe a little different than is optimal, or we take some medications, et cetera, that might knock us out of underwriting for a plan. So it's important for us to lock in our Medicare supplement coverage while we can qualify for it guaranteed issue. So there's a period of time where you can qualify guaranteed issue. Now, going back to your question, Drew, are there people that are switching back and forth? The answer is not often, right? So what I say is that it's important to make that decision correct for the person that's enrolling into Medicare, and that could be that we start with a Medicare supplement and a drug plan, and if for whatever reason, the cash flow, and again, it's not super expensive, but the cash flow becomes untenable, or you're not interested and you're not using it, or what have you. We might say, okay, you can always go to a Medicare Advantage plan. There's no medical underwriting for an Advantage plan. There is for a supplement when you're outside of that guaranteed issue window. So you can always go to a Medicare Advantage plan later on. And even when you start with a Medicare supplement and you make a transition to a Medicare Advantage plan, you actually have a year to kind of try it before you buy it long term on a Medicare Advantage plan. And you could go back to your supplement if you wanted to, if you're within that year of making that transition. Now, the other piece to that, Drew, is that if you start with a Medicare Advantage plan and you're outside of that initial enrollment period or that guaranteed issue window, you cannot enroll into a Medicare supplement without medical underwriting, right? So
Yeah.
it's important to note there are some folks that will see the person in the pharmacy and they've got a booth set up and the plan sounds great and it's throwing in all these additional things. It's a Medicare Advantage plan in most cases. And if you enroll into that initially at 65 and you've been on it for, 8 months or longer, you can't go to a Medicare supplement without medical underwriting. And so really, really important to make that decision um, in the right way for you as the beneficiary at the beginning. There's also a phrase that we utilize, that typically when you start a Medicare supplement, when what we tell someone at Move Health is you're starting that and you are joining it for life, right? Our goal is that you are on this Medicare supplement for the remainder of life. And what we say is marry your Medicare supplement and date your drug plan, right? So your supplement, you're typically not touching, you're not making changes to it. It's going to be what it's going to be. It might have small, annual increases that you experience from a cost perspective, but that's going to stay where it's at. Your drug plan, on the other hand, you're typically going to reshop every year if you need to look at you're taking a new medication or things along those lines. And so, uh, marry your supplement, date your drug plan. Important to get that decision right. And so, I unpacked a lot there, Drew. Apologies, but I think it's
No,
an important one to understand.
that's probably puts a nice exclamation mark on what we've talked about here today. And I'll go back to what I kind of led with, that there are so many moving parts to this that you really need an expert to guide you, to educate you, and to guide you and help you make the right decisions with that. And again, since we were talking about money, obviously I'm a little bit biased, but I think involving your financial planner and the whole thing, the whole decision making, because we might need to do things like shift how we're earning income, increase,
Mhm.
your allocation to income generating to cover some of these expenses, et cetera, et cetera. So we're going to wrap up with that. We had a few more questions come in, which I'm happy to see. Shows that
Yeah,
people were listening, paying
of
attention.
course. Good.
But then we'll circle back to everybody. But again, Cole Craven with Move Health, thank you so much for sharing your time with us today.
Of course,
And
Drew. Thanks for having me. And again, important to know your options, important to know what's next, and utilize someone you know and trust, and who better to kind of bring into the conversation than the financial planner who's saying, okay, we want to make certain everything that we've done to this point fits into the plan, and like you said, that we're allocating dollars appropriately, and we understand the risk profile and all of those different things that are all a part of this conversation. So grateful to be here. Glad to share kind of the good news of Medicare. If I could give one thing at the end of this is that don't fear it, right? We fear what we don't know, right? And so
yeah,
hopefully this was me kind of turning on the flashlight and opening the closet. So there's no boogeyman in there, right? We don't need to fear it, but it is important and to be, sober and diligent about this process as you get ready to make that transition and make certain you're making the right decisions for yourself. And so happy to be here, Drew. Thanks for having us.
yeah. So we actually have a expression in my household that if you don't manage the circumstances are going to manage you. So
Bingo.
this is one of those scenarios where just like when we started out, like the time, you want to get within that 7 month window of time.
Oh
So,
yeah.
let's make sure everybody out there who's paying attention to this is managing their circumstances appropriately. So thanks again, Cole.
Of course. Thank you.